Hi guys, welcome to today's presentation. Yes, it is the first presentation of the year 2023. Yeah. Having said that, I would like to wish you a happy new year, which is 2023. And for those of you who are students, remember that we can never do well if we are not putting in much effort. So if we are not studying hard, we may not do well in our exams. So remember that even as we are starting this new year, make sure your academic goals are up to date, and then you're also doing your part by studying hard. And that is why this channel is here to help you prepare for your exams adequately. Yes. So having said that, let's move on with our presentation. So today we are going to look at fluid therapy. So now, in particular, we are going to look at how to calculate the flow rate. So remember, if you have not subscribed yet to this channel, remember to like, share, and subscribe so that you'll be updated each and every time that we post a new video. So now let's look at the definitions, some of the definitions which are in this presentation. So intravenous therapy. So intravenous therapy is giving fluid substances directly into the vein, or we can say it is administering of fluids direct into the vein. So the other definition is the drop factor. So drop factor is the number of drops it takes to make 1 ml of the fluid. So drop factor is a number of drops it takes to make 1 ml of the fluid. So when it comes to clear fluids, like normal saline, Linger's lactate, dextrosaline, for those clear fluids, it takes about 20 drops for 1 ml to be made. So it takes 4 drops of normal saline to make a ml. So when it comes to blood, remember that blood is a fluid substance or a liquid substance which we administer direct into the vein. So it takes about 15 drops of blood to make 1 ml of blood. Now, when it comes to calculating how many drops should be delivered in a minute, we use this formula. So according to this formula, we say droplet is equal to fluid to be administered in mils multiplied by the drop factor divided by time in minute. So this is the formula that we use. So I'll just go through this again. So droplet is equal to fluid to be infused in mils. So this is the amount of the fluid we are going to administer. For example, if we have maybe 2 liters, 2000 mils of Linger's lactate to be administered maybe in an hour or 2 hours, then over it has to be multiplied by the drop factor. So as we are going on with the presentation, you'll be able to see how we come up with this drop factor or where it comes from. So just what is important is to remember the formula. So the droplet is the volume to be infused. So this is the amount of fluid we want to administer to the patient. So it should be multiplied by the drop factor and divided by the time to be administered. For example, if it's in an hour or if it's in 2 hours, now this time should be converted to minutes. So this is about the formula. So for example, the doctor has ordered 1 liter of normal saline to be infused in 8 hours. So the droplet on the giving set is 15 drops. So our part is to calculate the drops to be given per minute. So now, usually this drop factor is written on the giving set. So it is according to how the manufacturers have made that giving set. So usually the drop factor will be indicated on the giving set. So that's where the drop factor is indicated. So according to the doctor's orders, you should be able then to calculate the fluids as follows. So this is our question. So this is our example. So let's do this. Let's calculate. So we said the volume should be in mils. It should be converted to mils. So 1 liter is equal to 1000 mils, and remember that the volume has to be in mils. So when the volume has been written or has been ordered into liters, it has to be converted to the mils. So 1 liter is equal to 1000 mils. Then we want to give this fluid in 8 hours. Now the 8 hours should also be converted to minutes. So 8 hours will make up 480 minutes. Then we have been given the drop factor as 15. So in a situation where you are in the hospital, usually the drop factor is written on the giving set. So always check for the drop factor on the giving set. It comes as according to how the manufacturers have made the giving set. So now let's move on. So we are going to calculate as follows. Here is our formula, and we've infused in the information, the data that we've been given. So the droplet is equal to, we said 1 liter is equal to 1000 mils of normal saline. So multiplied by 15, which is the drop factor. Then we should divide this by minutes, by the time, which has been converted to minutes, from hours to minutes, and then we should be able to come up with the number of drops to be administered per minute, like this. So this is how easy and simple it is. So what is important is to remember the formula, which is the droplet is equal to amount of fluids to be administered multiplied by the drop factor, which can be found on the pack of the giving set, then divide by the time. So this time has to be converted from hours to minutes. Then make up your mathematics, and there you have the number of drops to be given per minute. Now, why is it important for us nurses to know how to calculate this? So the importance is that it is always important to calculate how many drops to be delivered per minute in order to infuse the correct amount of IV fluids at the right time. So doing so will prevent complications such as fluid overload, which may lead to hypertension, heart failure, and pulmonary edema. So this is why it is important for us to know how to calculate the drops per minute, so that we avoid complications such as fluid overload, which can lead to other complications. And so this is where we come to the end of our today's presentation. So any comments,